Hi, my name is Libby Nguyen.
And I'm Kara Duffy, and we are second year occupational therapy doctoral students at St. Ambrose University in Davenport, Iowa. According to the American Childhood Cancer Organization, each year in the U.S., there is an estimated 15,780 children diagnosed with cancer. We researched occupational therapy interventions for the inpatient pediatric oncology population. We specifically researched about task-oriented training and cognitive rehabilitation interventions for this population and setting.
Our outcomes our articles focused on were to decrease fatigue, improve functional independence, and enhance cognitive skills while also improving occupational performance and satisfaction in children with cancer. We appreciate your time and hope this information can positively impact your occupational therapy practice.
According to Moore and Beckwith 2006, common experiences in pediatric patients within the oncology unit include excessive fatigue and pain, limitations in performing daily activities, increased dependence on caregivers, and lastly, decreased motivation. So our research led us to successful OT interventions that can decrease these factors by certain approaches to OT through management of fatigue and increased functional independence in ADLs. Management of fatigue and functional independence is critical for children to get back to a sense of normalcy. So in the first article by Colette and colleagues, they looked at task-oriented training, otherwise known as TOT, combined with conventional OT approaches. So researchers conducted a study implementing TOT in an inpatient pediatric oncology unit through a neurodevelopmental approach. TOT was completed through high repetition practice of skills through functional tasks with intermittent feedback, so then these skills could transfer to ADL skills. They wanted to compare the effects of TOT versus just regular conventional OT, and they were looking at the following outcomes: fatigue and occupational performance and satisfaction. They found statistically significant results in improving fatigue levels during and after activity, while also enhancing COPM scores for occupational performance and satisfaction.
The second article by Ackle and colleagues looked at cognitive rehabilitation intervention training in conjunction with routine therapy. The aim of this study was to determine the impact task-oriented cognitive rehabilitation intervention has on fatigue perception and independence in ADLs among children within a pediatric oncology unit. The results concluded that CRI positively decreases fatigue, improves functional status in ADLs, and increases cognitive skills within this population. In conclusion, both CRI and TOT are proven to be more effective than conventional OT interventions. Although these studies had significant results, this evidence may not be able to be generalized due to client factors. Further research is needed to identify the long-term effects of these interventions. One way clinicians can implement these interventions into typical therapy routine is to address cognitive interventions through the occupation of play. Some examples include having the child create a daily calendar or schedule, role-playing, school simulations, or card organization games.
Another way clinicians can implement these findings is to use task-oriented training through functional activities alongside client-centered fatigue strategies. For example, the OT can incorporate fine motor activities that can translate into ADLs like mealtime. Thank you for listening.